Now let's explore the medical and pharmacy module of Vistrata. Medical expenses are driven by a few things. 1. The health of a member. 2. The member's utilization. And 3. Providers' contracts. Reviewing and understanding all of this data in Excel is cumbersome and difficult, but with Vistrata, the user is provided dashboards, graphical interfaces, and other visual elements that make it easy to review major cost drivers. In this demo, we'll look at the main sections of a health plan's budget. Let's begin with the 4 major categories that fall under medical expense detail: inpatient, outpatient, physician, and pharmacy. The interfaces for each category are similar, and they allow the user to visualize and budget their cost and utilization while understanding which medical conditions and providers are driving their costs. The pages dedicated to the 4 major categories are comprised of certain medical conditions. As you see, the inpatient category includes skilled nursing facility, maternity, medical, psychiatric, substance abuse, and surgical. The outpatient category includes emergency room, other outpatient services, pathology, radiology, surgery, and therapy. The physician category includes ancillary other, office visits, other professional services, pathology, professional services, and radiology. And finally, the pharmacy category includes cardiovascular, central nervous system, gastrointestinal, hormones and synthetics, miscellaneous therapeutic, and other. As you see, having information grouped in this manner allows you to see which medical conditions drive costs. As you know, these categories are viewed differently, and Vistrata accounts for that in the way it presents cost and utilization. For inpatient utilization, the tool counts admissions and shows the average length of stay. The costs are allowed per day. For outpatient utilization, the tool counts visits and the costs are allowed per visit. Physician utilization counts service lines and the costs are allowed per service. And lastly, pharmacy utilization counts prescriptions, or scripts, and the costs are paid per script. Now let's take a look at the information on the graphs. We'll focus solely on inpatient utilization, but the other categories function in the same way. The graphs allow the user to see costs over time, broken out into the categories we just mentioned, which lets you clearly see the direction of expenses. You'll see that a trend line is also provided. If you look below, you'll see the actual increase or decrease of the trend. You'll notice that under your budget year, in this case 2014, there are input fields. These fields truly separate Vistrata from all other budgeting programs. Vistrata not only shows you trends, it also allows you to place next year's estimate on the same graph you're using. This helps you to easily visualize and understand cost and utilization movement. We'll look at this in detail in the budgeting and forecasting demonstration video. On the left side of the page, the budget is separated based on the scenario that you're working on, which includes book of business, geographic area, and the provider of service. These scenarios can be completely defined by you. Yet another benefit of Vistrata is that it provides you with the view into your health plan's major providers without needing to scroll through endless spreadsheet cells. This allows you to easily compare cost and utilization for similar expenses. For example, you can see that the cost of maternity is declining at Aurora, which is around $2,100 an admission. However, at the United Hospital System, their costs for maternity are increasing and are currently $2,800 per admission. All of this information is summarized and displayed graphically so that you can quickly see the results of your budget estimates. Here you see the facility, medical condition, expected admissions, length of stay, days, paid and paid PM. You can also see how that compares to the admissions, paid, and paid PM/PM for the previous year. That's an overview of the major sections of the Medical and Pharmacy module. Please watch the budgeting and forecasting demonstration video to see how fast and easy it is to create a budget with Vistrata. For a personalized demonstration, please call us at 1-844-237-3500 or contact us through our website at www.vistrata.net.